There was a study done by BI a few years ago that reported that almost 70% of dogs who went to see the vet in 2022 left without receiving any heartworm prevention at all, whether it be from an online pharmacy or from the practice itself.
Hey, VetFolio Voice listeners, I'm so glad you're back. This episode is sponsored by Virbac and features Dr. Jenny Rizzo, who joined me to talk about heartworm prevention in the context of client communication. Most of us are no stranger to this conversation. We know that heartworm prevention is so important for pets, but the fact that we are continuing to have this conversation sort of illustrates that compliance when it comes to administration of heartworm prevention is a challenge we continue to struggle with in veterinary medicine. So this conversation can result in a mix of responses. Most of us know how incredibly important it is to protect pets from heartworm disease, but it's also true that our knowledge, our ability to treat different conditions is continuing to expand more and more rapidly, and having more options for identifying and treating chronic processes like itchy skin and arthritis means we just have a lot to talk about during the annual exam. But the things that we've always needed to talk about, like vaccines, like heartworm prevention, haven't gone away. And it can be challenging to find time to really dig into heartworm prevention in that single touch point when there's so much to cover. And that's a challenge for the client too. They're trying to absorb a lot of information. They're trying to make a lot of decisions really quickly. Dr. Rizzo offered some great insight into common barriers to heartworm prevention and great tips on how to address those barriers compassionately and effectively so we can keep pets protected from heartworm disease and ensure a comprehensive visit for our clients and patients. Let me go ahead and introduce Dr. Rizzo and we will get into it. Dr. Jenny Rizzo graduated from Kansas State University in 2012 and since then has had the opportunity to work in many different facets of veterinary medicine, ranging from exotics to shelters to primary and specialty care to education and outreach. She's served on the board of the American Heartworm Society since 2016 and was the youngest and first female president of the American Heartworm Society. She's the president and founder of IntroVet, which is an introvert-friendly continuing education community for DVMs and technicians. Outside of work, Dr. Rizzo spends as much time as she can traveling and collecting Bark Ranger badges at national parks with her dog, Pistol Pete. All right, let's talk heartworm prevention.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Jenny Rizzo, thank you so much for joining me today. We're going to talk about spectrum of care as it relates to heartworm disease. And, I feel like heartworm disease and making sure that pets are protected against heartworms is a conversation that's so important. But there are some very real challenges that we can encounter in practice in making sure that pets are on heartworm prevention. So I'm excited to jump into this topic kind of in the context of spectrum of care. So thank you so much for joining me.
Yes, thank you for having me. I'm happy to be here.
Absolutely. Well, when we're talking about a spectrum of care considerations, how do you approach that? How does that relate to keeping pets on heartworm prevention?
So I think it is maybe pretty simple to start with this thought, but when we want to begin discussing spectrum of care as it relates to heartworm prevention, it's pretty important to first just remind ourselves of the basics. We want to remember that there are a ton of options for heartworm prevention, including orals, injectables, and topicals. And within all of those options, there are preventives that can be affordable within any budget. And so that's a very basic first step at incorporating spectrum of care. And then I also think it's important to remind ourselves that not every concern is financial. There might be other concerns that we need to discuss. And maybe that's another obvious sounding point. But I know after we've been in practice long enough, we start to develop habits and pick up on certain themes and routines. And it's easy for some of those less common points to kind of fall through the cracks. As we start down this path, I also think that it's helpful to, if we all understand the severity and the scope of the problem, so we can all get on the same page about why this discussion matters specifically around heartworm disease in the first place. So there was a study done by BI a few years ago that reported that almost 70% of dogs who went to see the vet in 2022 left without receiving any heartworm prevention at all, whether it be from an online pharmacy or from the practice itself. And when they divided the data out geographically, it wasn't just everybody in the northern colder states contributing to the numbers. It was true that about 80% of dogs in the Northwest went without heartworm prevention in that year, but also 64% of dogs across the entire South who saw a vet went without prevention. And so it's a huge number of dogs, the majority of dogs, and an even larger majority of cats who are going without heartworm prevention every year.
Wow. I mean, that paints a really powerful picture. And, of course, when we talk about heartworm disease, it matters very much so in the context of that individual animal, but also on a wider scale and how it affects other animals and the disease itself. So especially, we're here in the Southeast, we're in Florida, where I joke with clients that mosquitoes are our state bird. And, heartworm prevention is oh so important. But I think you also make a good point that it can become easy to sort of get, I don't know, maybe a little tunnel visioned on, it's a financial thing. And so if we're getting any sort of financial pushback, maybe that's an area where, I don't know, we tiptoe around a little bit more. But I agree. It's important to remember that not every person who declines heartworm or dog who goes without heartworm prevention is coming from a financial place. So what have you seen in terms of the barriers to heartworm prevention that are resulting in many, many dogs and cats going without prevention?
Yes, so cost is still a big one, and
Sure.
we'll get to that. But if we set that one aside for a minute, I think certainly I'll hear in practice from time to time clients who are concerned about the safety of medications, or maybe they've read something scary on the internet or had a personal experience. And we want to make sure that we find out those things and address them and talk about them so we can find a good path forward that hopefully isn't no prevention at all. Many clients might not just understand why it's important. They might think they don't need it. They might misunderstand what heartworms are. They might not know what they are to begin with. And so we want to dig in a little bit into the reasons why they don't think their pet needs it or they don't think it's worth giving, because that's a wide pool of possible options. Some people might object to testing annually for heartworms. Maybe they want the prevention, but they don't want to test. And then that's a different barrier that we would want to address. And even sometimes clients just get overwhelmed, maybe by the large number of choices that they need to make at the vet, or maybe something crazy is happening in the waiting room or the room next door. And I think we all feel a little bit of anxiety from time to time. And sometimes that itself is a barrier.
Yeah, gosh. You hit on so many important ones that present challenges for the veterinary team and for clients, especially because we're having this conversation a lot of times at an annual wellness exam. And there's so much to discuss in those specific exams. And they're varying amounts of time that were allotted and varying ways that team members are included and involved in those exams that can create challenges. Sometimes I feel like we hear from all different levels of preventative care to say, well, make sure this is getting addressed in the annual exam. Make sure this is getting addressed in the annual exam. And it can be overwhelming to the veterinary team and to clients and cause some of that really, really crucial education to sort of fall by the wayside completely unintentionally, just because there were other things we were talking about in that moment. But I think your point is really good in terms of getting overwhelmed. If you can't tell, that one really resonated with me. To remember that heartworm prevention and having that conversation and knowing that dogs need heartworm prevention is second nature to us. It's of course they do, but not necessarily to clients, and making sure that we're we're having that conversation and providing that education that we're there to provide. I want to also go back to the safety conversation. That's another one I also hear very commonly. I sometimes bite my tongue and don't give a glib. I don't give glib responses, but sometimes I have to bite my tongue not to, because there are, we talk about all natural products and things like that. They want an all natural product. Unfortunately, I just don't know that we can really have like efficacy in that space. So how do you approach those conversations with clients?
So first, when I have a client who's concerned about safety or is mentioning something about all natural, first I try to find out what their specific safety concern is so that we can make sure we address those risks directly. And then we want to ensure that their pet gets tested for heartworms before we start prevention to check another safety box, and then ensure that the client understands how to give the preventive correctly. We know that adverse events can happen for almost any drug, but it is true that dose for dose heartworm preventives historically have fewer reported adverse events than any other class of drug. And so that can, be a comfort once we've made sure that we address the client's specific concerns about what risk there may be. And then this is a fun one. Anytime I come across a family who is trying to do all natural, or they've got a specific set of wants about the types of products they want to give to their pets, I like to explain that ivermectin was derived from soil samples. And so you can say, this is about as natural as we can get. This came from soil originally, and now it's preventing dogs from getting heartworms.
Huh. Yeah. And actually, I did not know that. So I love that as a talking point. And you said something there that I think is important, of really getting down to what the goal for the client is, because as easy as it is to say, okay, well, your dog's not going to be protected if we don't have them on prevention here. A lot of times, if we do have a client who's wanting an all-natural product, or who's concerned about safety when they're administering these drugs long-term, a lot of times there are some personal experiences there that are driving the desire to either not do prevention or to use a different type of product. So yeah, being open to where their motivation is coming from and being able to address that. And I actually love that talking point of saying, if it's more of a natural approach that we're looking for, well, actually that's kind of what we're doing here.
Yeah. And I think as long as we understand what their concerns are, we go through risk profiles and find something that is going to fit their specific needs, we'll be in good shape.
Sure. And having that conversation and trying to understand concerns around administering prevention, be they financial or safety or whatever it may be. What if we go through that whole conversation and we end up with someone who just feels like it's unnecessary for whatever reason? How do you approach those cases?
So this is a big category again, because there are all sorts of reasons why a client might think heartworm preventive isn't necessary. And so this is another situation where it's important to stay open-minded, ask questions, and try to let people be who they are and give them a chance to talk, so that you can get to a point where you can say, oh yeah, I understand why you would think that. Or lots of people have told me that before. And then you have built a bit of a bridge and now have space to clear up whatever it is they're misunderstanding about heartworm prevention. And if you need some cool facts to throw back at your clients, and you can always reach out to the Heartworm Society if you've got a specific situation, or my head is full of stats if you ever want to reach out to me personally.
I love stats. Do you have a favorite stat that you have found is helpful? I mean, I think the one you threw out there in the beginning of how many pets are leaving without heartworm prevention is a big one. Do you have like a go-to where like this, it's okay if you don't?
Well, the first one that comes to mind that we address a lot at the American Heartworm Society is the idea that pets don't need prevention in the wintertime or when the weather's cold. And so there are lots of cool studies out there about defining this concept of a heat island, where there are pockets of warmth that let mosquitoes survive the winter and survive cold days around heaters and in your garage and in barns and in between buildings and city centers. And maybe that doesn't have so much directly to do with spectrum of care, but if the reason why a client's trying to decline prevention or believing they don't need it is that they think it's too cold outside, there's a lot of data out there about how many warm hiding spots mosquitoes find to continue existing through cold days.
Mosquitoes are the worst. I mean, I get it here in Florida that we're going to have them year round, but if I was up north and it was cold and snowy and then I got bit by a mosquito, I just feel like that's insult to injury right there.
Yeah.
Uh, Another barrier I know that I've heard people talk about is I can't get the medication into my pet. I've heard all kinds of creative stories of, crushing it and mixing it in peanut butter, administering it in quarters and having to pill pets. And, I feel really fortunate that my dogs will eat anything, and I haven't encountered that. But when I hear people talk about difficulty administering oral medications, and then I'm asking them to give something monthly, really, I mean, my heart kind of goes out to them because that sounds stressful and potentially concerning for the human-animal bond.
Mm-hmm. I'm one of the pet owners who's been in that boat in the past. I had a dog, a golden retriever, he would not take any oral medications, anything that I could successfully hide a pill in one time. He would never eat that food again. And so luckily with heartworm prevention, this is an easy one to fix because we have injectable and topical preventives. And so if oral medications are a no-go for your dog like they were for mine, there are plenty of other products that you can choose.
Do you mind sharing how you approach that with your golden?
I used topicals for many years, and then I would sometimes use oral medications, but rotate every month what thing I was hiding the pill in. But that's really not a good thing to tell a client because it's going to be very difficult for them to try to comply with something like that. But I use both topicals and injectables depending on the year over the course of his life.
Okay, absolutely. So exercising those other options. Yeah, I had a lab it was when we were still using tramadol pretty regularly, and he would eat anything until he figured out it had tramadol in it, and it became a battle of wits there for a while of getting it into him. He won a lot. Mm-hmm. Well, let's circle back around to financial concerns. As much as I think it's important to remember that there are plenty of barriers outside of finances that stop clients from purchasing and administering heartworm preventatives, certainly financial concerns are a big one. So when we do talk to that client and we find out that their primary concern is financial, what recommendations do you have for kind of navigating that conversation?
Okay, I have lots of recommendations. So we'll start with one that I think is the most fun or super practical, maybe. When I am chatting with someone and they're worried about the cost of a month of prevention, I try to relate it to other products that they're probably buying already, and maybe even something that they think is cheap or affordable or that they get all the time. So to give you an example, a generic ivermectin and pyrantel-based monthly heartworm preventive costs about $6 a month. And you can go to any coffee shop in the country, and a coffee or a latte these days is going to cost at least $6. And many, if not most of our clients are probably used to coffee runs a few times a month. So you can say, hey, this preventive is as cheap as one cup of coffee or one latte. I just went grocery shopping recently, and a family-sized bag of chips was $8.
Whoa.
So a bag of chips costs more than preventive in this case. I got my 12-pack of sparkling water, and I think that was $7.99. And some of them are even more than that, depending on how fancy we want to get. But, the millennials and I love our sparkling water.
Absolutely.
So that could be a great example. And then if we talk about combination products, there are topicals out there that cost as little as $16 a month. And $16 is less than the most recent chicken finger meal that I got for dinner one night. Costs the same as my Netflix subscription. This is going to shock you too. Groceries are expensive.
Yeah.
I bought a 6-pack of generic brand paper towels recently, and that 6-pack of paper towels cost more than $16. So there's a whole bunch of examples there that you can pick any one of those as your fun fact to share with the client to help them kind of see that there are super affordable options. And then it's a good idea, if you're going to talk about these very affordable options, to have that in stock at your practice so that you can show it to them, give it to them right away. That way, nobody is hopefully leaving empty-handed from your practice without their preventives. Or you can maybe help them get signed up with an online pharmacy and get those delivered 1 month at a time so that, maybe they don't even want to afford a 6-pack or a 12-pack of an inexpensive preventive, because that still can be a barrier for some people. If you can sign them up to receive it once a month in the mail, then it's truly just a $6 a month cost that they're having repeatedly.
Yeah. Yeah. And I find that the once monthly delivery through the online pharmacy, especially if I have someone who doesn't want to purchase a 6-pack or a 12-pack, it helps with compliance too, because they're like, it shows up in the mail and I give it and I don't have to remember. And I certainly have clients on the other end who say, absolutely not. I need to have all 6 there and mark it on my calendar. But I'm in the first boat where it's helpful to just have it show up and give it. And so it can help with spreading out the cost, even if there's, shipping and everything, over the year, it might add up to a little bit more, but it spreads it out so much that it can make it easier for clients to kind of wrap their head around it 1 month at a time. And then also maybe help with compliance a little bit. What about tests? That's another area I think you mentioned earlier that we'll get some financial pushback to say, well, I've been giving the prevention. Why do I have to do a heartworm test?
Mm-hmm. Doing the heartworm test annually is still important for safety, and it's important to catch breakthrough cases when, unfortunately, a pet does end up heartworm positive, even though their client has given them preventive through the course of the year. So we want the test and we want to prioritize the test, but it's totally understandable that sometimes the cost of the test itself is a barrier. And the best solution I've come up with so far in practice to this one is to keep in stock in the practice a box of super inexpensive antigen tests. I've seen some that you can order a box of 25 or 30 and it costs maybe $3 or $4 per test. And then as a practice, you have to make your own decisions on inventory and prices, but maybe you can bundle that $3 or $4 test into the cost of your exam or the cost of something else that a pet's going to automatically be doing. Or maybe you bundle it into the cost of a 6-month box of prevention, so that you can kind of take testing off the table as a financial barrier and just make sure that it gets done and it doesn't have to be a point of contention or discussion with the client.
Yeah. One less decision, when we're talking about client overwhelm, to say this is just a part of, we do this test as part of the cost. This isn't something we have to discuss why we're doing it and why is this additional cost on here? It just is part of it. Yeah, I think that makes a lot of sense. Different practices need to kind of evaluate where they're running into these troubles and figure out how that fits best into their practice. But, I agree, there certainly are some inexpensive antigen tests out there that can be really helpful. I think I've also seen some of the labs where we send our blood work out become aware of this of the heartworm test cost as a barrier, and it being a smaller step up to include that in some of the other lab work that we're already sending out, which can make that conversation a little bit easier too.
Yeah, that's helpful as well when you're sending lab work to outside labs routinely. If a heartworm test is just something that's automatically bundled into the rest of the lab work that you're wanting to do, it's the more affordable and easier we can make it, I think the better.
Absolutely. And when we're talking about overwhelm and decision making and things like that, I mean, that can go for all of us, not just the client, when there's so much to discuss, especially in annual exam appointments. So it can help to spread these conversations out a little bit. It can help for a lot of reasons to not just as the veterinarian be going in there and trying to explain everything, but we have very educated, very qualified, wonderful support staff, technicians, assistants who, they have a lot of knowledge and experience in this area as well. So I would love to hear your thoughts on incorporating the whole team when we're having this conversation.
Yes. As a baseline, I think it's very important that the whole team or anybody who's going to be communicating with clients is on the same page about heartworm prevention and about heartworm disease itself. So we want everybody to understand the basics of what heartworms are and how pets get them and what prevention does and why the prevention matters and what happens if your pet gets heartworms and so on and so on. And so if you feel like your team could use some training, that may be one good jumping off point. And I have a list of a couple of good training resources I can pull up for you in just a minute. And if you feel like everybody's well trained, then the next step, or another issue I've encountered, is you want the whole staff to feel empowered to say that they don't know, or I'll get that answer for you, instead of brushing off the question or not asking for help or making up an answer that's not real. We want everybody to feel comfortable being able to communicate with each other in an office without getting too far down the rabbit hole. I'm sure everybody can picture a situation where the receptionist is afraid to come back and ask the one technician who's running the show to bother her in her busy day, to ask a question. So we just want to make sure that everybody has good channels of communication open, and that if someone gets asked a question about heartworms and they don't know the answer, they can go find the answer and not just shut the client out or not give them an answer. We just want everybody on the team to be giving the same unified message to a client as they move through their practice experience, from the phone call when they called, ask a question or set up an appointment, to when they're meeting with the technician and going through history questions, and then to the doctor. We want the message to be the same. And, if we're talking about trying to avoid overwhelming ourselves and clients with big educational talks about so many topics to do with preventive care, then maybe you start to think about sending emails periodically that are educational to your clients, or getting information out there other times of the year and not just during their annual visit, so that we can be helping them all year long.
Yeah, absolutely. And they can absorb some of this information. I love the idea of like a newsletter or something, or a social media post and things like that, that give clients the opportunity to really absorb some of this information when they're, in the middle of an appointment and having to make multiple decisions, and there's finances involved, and they're worried about, are they going to get their pet home in time so they can make it to work after the appointment, or whatever it may be, but in a more relaxed way that can speed up the conversation a little bit during those appointments and provide time to talk about other topics. But also it can facilitate being able to dive a little bit deeper into the topic, where instead of just jumping off at the starting point every year, because of course, clients, not unlike us, are not going home and thinking about heartworms all year long usually. Maybe they have that information and show up with questions. They know the basics, and we can dive into that conversation a little bit more effectively and make sure that we have the right solution for their pets.
Yes, absolutely.
Both of these topics, heartworm prevention and spectrum of care, are hugely important. We can't talk about them enough. Are there any final thoughts you want to share?
Yes, I promised I would share a list of some additional resources, and I pulled it up. So now I can remember them and not leave one out.
Great. Let's hear them.
Yes. Okay. So first, Verbac has some really nice free CE and great resources, including the important safety information on their website. I just did a Google search for Verbac Learning and Resources and was able to find that landing page. If you want to get some more education or other resources for your staff, a great place to go would be the American Heartworm Society. At their website, they have a 5-part video training series called Unraveling Heartworms, and that's available for free. And each video, I think, is 20 minutes or so. And it's meant specifically for vet support staff to learn about heartworms and how to communicate all the concepts with your clients. There's a nonprofit group called Open Door Veterinary Consults, and they have a free course on spectrum of care as it applies to heartworm prevention and treatment. So you may get some more good ideas there. I helped make that course, so that's why I'm familiar with that one. And then if you would like to have some exam room entertainment for your clients, the American Heartworm Society also has about a 5-minute video on the heartworm life cycle that's made for pet owners, with some really great visuals and graphics and description of how pets get heartworms, what happens inside the body, and why prevention is important. And so you can do some passive education while people are waiting in your lobby or the exam room with that video.
Yeah. I think it's such a great reminder that there's so many opportunities nowadays to reach out with information. So even though there's so much to discuss in the exam room during these appointments, there's also a lot of opportunity for outreach at other times of the year, in other situations where we can still get the education out there and not feel like we're having to explain so much and go over so much right in that, 20, 30-minute time slot.
Yes.
And for our listeners, we'll make sure those resource links are on the podcast page at vetfolio.com so you can check those out. As with all heartworm prevention products, all dogs or cats should be tested for heartworm disease before starting a preventative protocol like Iverheart Max Chews for dogs, Iverheart Plus for dogs, Synergy for dogs and cats, Parasedge Multi for dogs, and Parasedge Multi for cats. For Parasedge Multi for dogs specifically, like all topical products, do not administer orally. For the first 30 minutes after application, ensure that dogs cannot lick the product from the application sites on themselves or other treated animals. Each product's full prescribing information can be accessed from this episode's page on vetfolio.com. Well, I hope that conversation was helpful to everyone out there listening, talking about common barriers to compliance when it comes to administration of heartworm prevention. A big thank you to Virbac for sponsoring this episode. Thank you to Dr. Rizzo for joining me. Such a great conversation. And of course, thanks to everyone out there for tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you'd like to hear more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. As always, I'd love to hear your thoughts on this episode, your ideas for topics you'd like to hear from us in the future. So feel free, you can reach out to me at dvm@vetfolio.com. We can also connect on Facebook or Instagram at Dr. Cassie DVM. And remember, if one animal is better off because of you today, it's a great day.